welcome back to the Jameson Files. I'm Carrie Weber with Jameson, and I'll be your host once again for this episode of the Jameson Files podcast. And once again, I'm thrilled to be joined by Dr. Shannon Maddox of Oklahoma City, Oklahoma. So thank you so much for being with us, Dr. Maddox.
Thanks for having me.
I am really excited to have this time and this conversation with you because I say this frequently to people, and I really believe it to be true. Sitting in your office, being a patient, but also observing you with your team and with your patient family, I consider you one of the best communicators as a dentist that I've ever seen and been able to see in action. And I believe that not only from a point of case presentation communication skills, but really in your relationship building with your patients and how you educate your patients. The time that you prioritize to do that so effectively and how well and how eloquently you do that is really quite extraordinary in my opinion. And I know we're friends.
Thank you.
And I know you could easily say that I'm biased, but I'm not.
You might be a little biased, but I do appreciate it nonetheless.
So I want to talk a little bit about communication skills from the doctor-patient relationship. How you have, it's obvious to me that you have made that a priority for you professionally. Yeah. How you manage to develop that, I know some of that is a gift that you have. But I've come to your office and tucked away in your consultation room with you before just to pick your brain because I wanted to know, how you have honed that for yourself and because I believe a lot of doctors and hygienists, team members, treatment coordinators could really benefit from any tools or any exercises or anything that you've done over time to be the best that you can be when it comes to patient communication and education. So tell me a little bit about where does that fall in terms of prioritization for you in the relationship and how do you make the time for that? And how have you learned to refine that skill over time? That was a lot of questions all in one question.
I'll try and remember them all. Remind me if I forget. Yeah, absolutely. It's, I would say, probably my most important priority when I think about the way that I practice or the way that I want my team to function. Because without sounding cliche, people cannot make educated decisions without knowledge, right? Mm-hmm. So if you want to have confidence in the treatment that you're providing people or the treatment that patients have agreed to, you have to know that they know all of the facts before they get in, right? So I don't feel confident if a patient doesn't know what's happening.
Right.
I can't feel confident in the care that I'm providing if they're just blindly trusting me. And it gets kind of awkward at times because there are patients that want to blindly trust me. Oh. There are patients that, hey, I don't want to know anything. You're the doctor. I don't want to see a picture. I don't want to talk about it. You just tell me how much it's going to cost and we'll do it.
Wow.
And I have to kind of say, no, that's not how I do things. I need you to know what's going on, and I need you to tell me what your goals are, what you want, not I don't want you to end up with the smile that I want you to have. I want you to end up with the smile that you want to have.
Wow. And I think that just to say, if that is not a description of the level of trust you have built in your patient family, I don't know what is.
Wow.
Such a testament to you that your patients would step in and say, "It's okay.
Just do it.
Just tell me what I need to do, and let's do it." My father was the same way. Patients that would step in and do that. But I love that you, in the previous episode, you had said, it's easy to settle for good enough, and you don't ever want to settle for that.
Right.
And I think you saying, no, we're going to talk about this so that you are crystal clear.
Yeah.
Is a testament to that.
Well, and so much, goes into when we sit down with a new patient specifically. I can't tell you how many times there's been a situation that they've told me about in their dental past that would have just been completely different had somebody explained what was happening. The disease process that was going on in their mouth, how to treat that disease, what's the best way, or what are the options for treating that disease, what are the financial aspects of treating that. So if you don't cross off all of those boxes, then patients are left with question marks. If they don't have check marks, they have question marks. And so, if they leave your practice, those question marks never get filled. And so it's always a little bit of, I don't know why he did that, or I don't know why she told me that. And I don't want to be that. I never want to, if they leave my practice because we're not a good fit, A-okay. But if you leave my practice because you don't know what's going on, that's all on me.
Right.
And so it's important to prioritize that time. You put that really well. You have to invest the time to be able to say, this is everything that's going on in your mouth. This isn't the part that I'm going to tell you today and the part that I'm going to tell you in 6 months and the part that I'm going to tell you 5 years from now when you believe me. This is everything that's going on in your mouth, and we're going to talk about it all today.
And if I were to look at your schedule,
Yeah.
are you prioritizing time within your schedule to have those conversations, or is it such a natural part of how you communicate that it just really blends in with a minimal time frame?
No, it's prioritizing time in the schedule. I have to make sure that I have time. And there are instances within my professional career where the system has broken down. I don't have adequate time. I'm rushing through it. And it's always a regret. I always regret that conversation. So we try and follow a pretty specific system for our new patients. And I've noticed throughout the years that when we get off of that track, if we're trying to fit somebody in for an emergency and we're just trying to take care of somebody, and your intention is good. I'm trying to take care of you. You have this need today. I'm trying to fit you in. But you're fitting them in, and you have other people on the schedule that need you to, and I can't be everywhere at once. I'm having to have this conversation really fast, and it never works. They either don't believe you, they don't trust you, or they leave with question marks, and that's really regrettable to me. So I'm pretty specific and the team is pretty specific about what we need in a new patient setting or in an existing patient that has a need setting about conversation. And so when I schedule a new patient, I schedule enough time to have that conversation. If I don't have enough time to have that conversation, I schedule a consultation outside of that normal. I don't go down the road of having the conversation with somebody if I don't have enough time, because I've done it and it doesn't work.
Dr. Mark Hyman, who was a client of ours for 15 years, but is also an extraordinary speaker in his own right across the country, calls it sacred time.
Sure.
That you have this sacred time to communicate, and that made all the difference for him in his practice building in his career.
Right.
And what would you say to anyone that said, "Wow, that sounds all fine and good, but I really don't have time in my schedule for this"? I mean, what would you encourage people to do to make a shift in the prioritization of time in their schedule today if they haven't been doing that historically? So
you have to do it. I would say you have to do it with your new patient. Your patient that has never met you, has never met your team, does not have any level of trust other than potentially the referral that they got to your practice, that you have to prioritize that time with them then, because that's the solidification of the patient experience. If you can solidify trust in that first visit, then you can outsource the trust the rest of the time. You can teach your team how to communicate with people. You can teach your team how to talk about disease. You can have team members that are extensions of your personality and in your vision and the way that you do things. They can take care of it for you, because I've got to prep a tooth, or I've got to do what, I do dentistry. I don't just talk to people all day. So you just have to do it once. If you can do it once, then the rest of the team can take care of it the rest of the time. Right. So I would say make sure that you're prioritizing it with your new patient visit. Make sure that time is sacred in that new patient visit. And then the rest of the time, empower, teach your team, model that for your team so that they can hear the words that you're saying and hear how you want something to be explained. My hygienist can talk about occlusal disease. Yeah. coming out of dental school, I could barely talk about occlusal disease. So if my hygienist, my entire team can talk about occlusal disease.
Right.
So if you can invest the time with your team outside of the schedule to teach them how to talk about things, and you invest the time in your schedule for the new patient, I think you're going to be ahead of the curve.
So what does that look like if I'm a new patient coming into your practice? What are some of the ways that you begin to break down maybe those barriers?
Yeah.
Do you have some ways that you start those conversations, or it seems to me, but this could just be my skewed perception when I'm with you, people seem to gravitate to having those conversations with you fairly easily, but is that truly the case, or are there some kind of some door openers and some ways that you communicate to help them, and maybe some of your body language or whatever the case may be, that help them really get into conversation with you so that you can have those clarifying conversations that are so important?
Well, I mean, I think it just starts out as a conversation. People want to tell you their story. Very rarely do people not want to tell you what's going on with them. They come to the dentist because they want to be there. They don't seek care because they don't want to be there. So you have to ask questions. Why are you here? What are your expectations? What are your goals? And those lead to more questions. People will give you a list of 3 or 4 goals that include 10, 15 follow-up questions. And so you just have to be willing to take the time to ask the question and take the time to listen to the answer. Because if you're not listening, then they have to feel heard. And being heard is probably the biggest hurdle to trust. So, because they've been to other dentists that haven't heard them.
How do they respond? Do you get a lot of, what's the response to this experience from your patients?
So initially, there's the occasional, I don't have any goals, I don't know what you're talking about, right? But you can lead them through that and try and kind of peel the onion layer back. And eventually most patients, and I would say the majority of patients, thank you for asking me. No one's ever asked me that before. Or I've never been, we do a consultation before we bring them into the dental chair, just because dental chairs are a little scary.
Yes.
And so we bring them back into my office. We discuss things back there. Thank you for taking the time to talk to me before you started popping x-rays in my mouth and taking pictures. So we take that time, and they appreciate that. They recognize it. It's different, and people like different for the most part. And if they don't, it might not be the best fit.
Right.
And so that's okay.
Yeah.
That's okay if they want wham, bam, done, thank you, see you later. But that's not the kind of dentistry that my office provides. And so it's okay if that's not a good fit. But for the most part, my patients that stay with me for the long haul are the ones that like it.
Yeah.
And I can sleep at night because I'm providing them the type of care that they want, that they desire. I know that they know what they're getting themselves into.
Right.
I don't get into any situations where I'm like, I shouldn't have done it that way. They agree to every aspect of what I'm doing.
Yeah.
And so I feel better because I'm reaching their goals.
And when you know their goals, even if when you go in to do their evaluation, you discover maybe disease that was not expected by them. By knowing their goals, you can typically tie it back to what's important to them. And you're pretty masterful at that, too. I mean, bringing them back to what brought them to you in the first place. Do you find yourself having those conversations with them? What's that look like? Because you sit me up and talk to me in the most extraordinary way. And you remember the things that are scary to me, that are important to me, and you remind me that those are important to you too.
Sure.
Is that common for you?
It takes work. I wouldn't pretend like I do that. I've always done that well, and it's taken a long time. I'm pretty self-critical, and so pretty much after any conversation I have, dental or non-dental related, I'm running back through that conversation as to what I said, what I shouldn't have said, what worked, what didn't work. And while that might drive me nuts most of the time, it helps me in my professional career
Right.
because I'm able to kind of hone in on, oh, that didn't work.
Right.
That didn't resonate. That wasn't a good way to explain that. That wasn't a good analogy, whatever that might be. Why didn't that work? Is it that person, or is it not a good way to explain what's going on? And so it takes work to remember and to hone in on people's goals and to remember that each person is a person. But I mean, I write down their goals. I don't have this masterful memory.
Right.
I write down their goals. They're in their chart, but they're on a piece of paper.
But that's great. You're documenting those conversations.
Yeah.
It's
and they're
not-
on a piece of paper sitting in front of me. So when
Yeah.
I'm talking about your treatment plan, I'm always talking about it in terms of what it matters to you. Because it doesn't really matter if it matters to me. I don't have to spend 24 hours a day with your teeth.
Right.
So if it's your mouth and your smile, and it needs to matter to you.
Yeah.
So if it doesn't, then I can communicate more effectively to try and explain disease, and I've got to spend more time in the disease process and what that means for you if that's not resonating with you.
Yes.
But if it's something that you already want, then tie it to a goal. And
You had talked about in the previous episode,
Yeah.
You had talked about in your early years of your career, the first year and a half of your dental career was in a corporate setting, and that you learned a lot about the different mindsets of the different patients that
Yeah.
you were taking care of.
Right.
And those that were, that they had that insurance mindset. Do you find yourself, how do you find yourself working through that in your practice to help patients meet their goals, even if it means they have to look outside of the minimal acceptable that their particular
Right.
plan provides?
So I learned a lot in the corporate setting about that patient, not about managing that expectation, not about getting around that hurdle, but about that patient. What's motivating to them? Why is that a motivating factor? And it all boils down to either preconceived notions about insurance, and what insurance is and what insurance isn't, or a financial. A lot of people don't think that they can go out of their network. A lot of people believe that they have to see, that I would prefer to see somebody that has insurance than a cash paying patient.
Yeah.
So, they didn't see me because I didn't have insurance is a mindset for people. So
Right.
I do a lot of talking. We talk a lot about insurance, and it's quite frankly can be exhausting at times.
Yes.
Because it's just like this record player that's constantly going on. And I think my team kind of would rather not talk about insurance too, because it's just, we're tired as practitioners. That's the last thing we want to talk about.
Right.
But patients need to know
Right.
what it is and what it isn't. And there's a lot. I've done a lot of research and a lot of thinking about it and a lot of talking about it with peers of mine that, insurance in today's day and age is not what insurance was 50 years ago when it
Right.
was created. And it's a maintenance plan. And you've got to talk to patients as
Yes.
if it's a maintenance plan. And they need to know that it's a maintenance plan. Because if they see it as health insurance or home insurance, if your house gets taken up by a tornado, as we live in Oklahoma,
Right.
they're going to pay for
Right.
what the damage was that was caused. If your mouth is taken up by periodontal disease, they're going to pay for 50%, 80%.
Right.
That's a problem. And patients need to know that that's a detriment and a hurdle to their overall health if they're only listening to what their insurance is going to cover, and they're forgetting to listen to the people that are spending time in their
Right.
mouth. So we have to talk about it.
Well, and that goes back to how you do prioritize that communication time with your
Yeah.
team, with your patients. That building of trust and value,
Yeah.
and that sense of need for more comprehensive care.
Right.
It seems like you've come a long way from starting in that practice when you took it over to where you are now in terms of the patient's willingness and readiness to hear what you have to say.
Yeah.
But I love what you had said about the team and how your team communicates equally as effectively as you do, and it's true. But you had talked about that you prioritize time outside of the work of the day-to-day,
Right.
To hone in on that and refine those skills. What's that look like for you and the team? How do you all work on that to the point that they are more comfortable with those conversations?
Right. So first of all, during scheduled time, they hear me talk about
Yes.
it, right? So the most effective way of learning, I mean, as a parent, we all know this, you have to model it for your kids. So you have to model it for your team. You have to walk the walk and talk the talk and believe what you're saying. And they're going to hear it. And if they hear it enough, they know how to talk about it. And we talk about it at team meetings. Okay, what does this look like? How could we better, with hygiene meetings, how could we better talk about periodontal disease? What are the things that we need to talk about? What are the bullet points that we could hit? And really honing, did this work? What didn't work? Why did this patient not agree? Why is this patient still on the fence? We talk about that in huddle. Why is this patient still on the fence? What's the holdup? What do we think the holdup is? What can we do about it as a team?
Yeah.
Can you hit it and then I hit it and then we go back to it later, you know? So we talk about it in all behind closed doors together. We role play.
Yeah.
No one loves it. Me least of all.
Yeah.
But you have to practice, and it's better to practice with each other and laugh at it with each other than to not practice. So we role play. And we take time to figure out what the barrier is. I think that's the hardest part is that patient has said no to me 5 times. I don't want to talk about it again.
Right.
And you have to talk about it every time they're in. And it's okay. It might take them 10 years to say yes, and they may never say yes. But you have to be the leader, and you have to be the practitioner, and you have to tell them that that's still there. It's not going away. It's not getting better. And I'm supervising it. It's supervised neglect at this point.
Yes.
So we're not either, we have to do something, and I'm going to keep telling you about it. And not getting into the rut of like, patient is telling me no, and so I'm never going to talk about it again.
And I think that's a pivoting a mindset of that the understanding and embracing our roles in a dental practice.
Yeah.
No matter your role, when you are face to face with that patient, you are the primary advocate for their overall health and well-being, and it's a responsibility.
Yeah.
And when team members can own that sense of responsibility with their doctors, I think it builds up more of that trust and understanding, but also a sense of pride and respect that, keep saying no, but I'm going to keep showing you the risks that you're choosing to roll the dice on
right.
by continuing to say no to this treatment. But it doesn't mean that we don't continue bringing it up. And I feel like your team does that. There is a sense of pride when you go through a new patient experience, such as the one that your team does, from the team members as well.
Yeah.
To be a part of a process that is such a value building process for a practice in relation. When it's so patient focused, it's really marrying a partnership between that patient and you and your team.
Right. Well, and it has to be unacceptable to not explain things.
Yeah.
And it has to be unacceptable to not talk about what's good. You have to create a culture where it's unacceptable for you to not talk about fluoride at a hygiene visit. It's unacceptable for us to not talk about wear on patients' teeth if we see wear on patients' teeth.
Right.
Because it's easy to not. It's easier to not push the barrier. If the patient's happy and just tell them everything's good, and that's easy. And we have to create a culture as the leaders of the practice that we have to create a culture where that's not how we do it here.
Yeah. We have to believe in it first.
Right.
If a patient's ever going to believe in the value and the need for that kind of proactive care in their dental health, we as the providers have to believe in it.
Sure.
For it to ever take root for them to see the value in it.
Absolutely.
I absolutely agree. So for you, I don't know if this is a tough question or not, but of all the different places and spaces in which you communicate and educate and connect with your patients, if you had one starting point, I know you'd said the new patient experience, prioritizing that time, but from a communication standpoint, for those that recognize, I know I could be better at this.
Right.
Do you have a starting point that you might recommend that they hone in on, that they assess for themselves and how they do it in their practice, or maybe some questions or something for them to start with?
So I would say, you said one, I'm going to give you two. I would say what I said before about goals, asking goals for patients. Ask them. Just ask them and listen to their answers, because
And write them down.
And write them down. And revisit them, because they'll lead you down the path that they want to be on, and then you can pick up on that path, and they'll feel heard. They've never assume that they've never felt heard, because they're still looking for a new dentist. And if they're still looking for a new dentist, they're probably not, they haven't ever been heard the way that they want to be heard. So you just have to keep asking, and and revisit it. It's not just a one-time thing. What your goal is in 2019 might not be your goal in 2025. So you've got to revisit them.
Yes.
And then the second thing I would say is making sure that you're utilizing different avenues of education. So once you kind of hone in on that patient, what their needs are, what their wants are, what their desires are, you've got to be able to show them the disease process that's going on in their mouth. So you've got to get a camera.
Yes.
You've got to get a monitor out and show them what's going on.
Yes.
And because they've either never seen it, or they've never been told it's a problem. And so you have to be able to utilize different avenues. We don't all learn the same. I'm an auditory learner. I hear a lot, and I can learn it that way. But the majority of people are visual learners, and so you've got to be able to have that there for them. Even if you're an auditory person,
Right.
I talk while I'm showing them all these pictures, because I don't learn visually.
Right.
But then they're hearing it at least two ways. They're
Yes.
hearing it through what they see, and they're hearing it through your words. So it's important to hone in on your different avenues. Get to know your patient, get to know what their expectations are, and then show them what they need.
I love that. I love how you just drove home. We all learn different in different ways. We all learn differently. We all take different amounts of time to make decisions that
Sure.
are best for us. And you have created an environment that not only is presenting education and communication in as many ways as possible for the different variations of ways people learn and retain information, but also that it's not a one and done conversation, that you are consistently having these kinds of conversations over the lifetime of a relationship with the patient. And that communication skills, it's not I can say it just one time and they get it, because we as human beings,
Right.
we take multiple touches a lot of the time to resonate and to make decisions and to take action. And so we have to embrace that that's a part of our professional lives, that communication is key. A lot of times I say, when you read bad reviews, when you see that a patient's left, when they've gone from another dentist to you, a lot of the times that's happened because there was a misunderstanding and
Sure.
expectations. There was a disconnect. And if we can prioritize the communication like you do so well, that can make all the difference in making sure that message sent is message received. And just as you beautifully stated, that patients can make the decisions that are best for them, and you can sleep at night because you're clear, they're clear, and you have a happy, healthy patient family. So thank you so much for being with us.
Thanks,
It's been
Carrie.
a pleasure, and I look forward to more opportunities in the future. Thank you for joining us on this episode of the Jameson Files. Visit us online at jmsn.com. You can subscribe to this podcast on iTunes, Google Play Music, or Spotify. Do you have questions or topics you'd like for us to answer or cover on the next podcast? Email us at podcast@jmsn.com.